Doc is back. Welcome to Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join Doc and his guests as they discuss healthcare and the Caribbean community every Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms.
I didn't grow up here, but Broward County has become home to me. This is where I settled. I raised my family here and started my practice here. For over 20 years, I've represented my neighbors, people who needed help in a stressful time. If you find yourself in need of an attorney, reach out to someone you can trust, someone with a proven track record.
When a car accident or personal injury sets you back, call Scott McCullough.
954-989-3435.
Hello, ladies and gentlemen, and welcome to this week's episode of Medically Speaking with Dr. Winston Alexis. Today's show is sponsored by Scott McCullough. Doc.
Yes.
How are you this fine day?
Oh, very good. And that's, I would like for you to repeat that once more. Sponsored by whom?
Scott McCullough.
This is, the gentleman is an attorney. Extremely good attorney. How do I know that? He has done business with my family before.
Okay.
Where he had handled some business with accident and something for one of my daughter's husband brother.
Okay.
And I'll tell you, he was extremely good at what he did. But more importantly, he has been a friend of the Caribbean community for quite a while. I got to know him while he was in college at Nova. Right? And a friend of my big son who doesn't live here anymore. But I got to know him. And when he graduated, so he knows the Caribbean community well. Mm-hmm. He has always participated in it. Right? And I remember we had a conference at about 2 years ago. You know me, I'm always in this community thing.
Absolutely.
Where we give a thing to about health insurance and stuff.
I remember it. It was at the Sawgrass Conference Center in St. Holiday.
And I went to him and I said, Scott, apologetically, listen, we're doing something. I'm running hard. We need somebody to sponsor this program for us. He said, Winston, Doc, how much you want? He brought out his checkbook. He wrote for $1,500 to pay for the facility. We did not have to pay for the facility. And we had a full day with food and everything that day. And I don't know, some people would remember it. So he has, again, once he hears what we are planning to do with this, and that brings us into what we are about.
So, ladies and gentlemen, once again, today's episode is sponsored by Scott McCullough. And Doc, let's talk a little bit about Medically Speaking, the podcast, and what this is leading us to.
All right. Ever since, me and you talked a little bit in the beginning, remember about Thunderbolts and some of the teams?
Yes.
I have always been struck by the idea that America has diversity, which is what makes it great. And how do you make the diversity? You let each ethnic group express themselves as much as they. The Chinese with the food.
Yes.
You understand the Spanish with the salsa. Mm-hmm. You understand with me, the West Indian with the reggae.
Yes.
I'm just talking about some cultural things, but also the education and bits of the culture that make this country great is everybody bring a little piece and add up. And I'm saying it looked like every other community is organizing in America except the Caribbean community. Example, we should own half of Brooklyn.
Oh, absolutely.
West Indian people should. I could even give you the perimeter from Flatbush, and you go to, I forget what the name of the parkway is where they have carnival. Mm-hmm. Bergen Street, that area.
Agreed.
Up from Bedford Stuyvesant was West Indian.
And here in South Florida.
Right, and we have no clout.
Right.
We have no voting clout. We don't have anybody representing us. We are
in comparison to other cultures. So
the
Cubans, the Haitians,
the Jewish people. Mm-hmm. And by the way, we say this with admiration.
Absolutely.
I'm not crying them down.
No, not at all.
They are right. This is the sort of things to do. Give you an example. I remember when I first come here, bunch of my friends, that I live, because I live in Plantation, it's mainly a Jewish commune. Almost all of my friends are lawyers. And they tell me history a little bit about North Miami Beach.
Mm-hmm.
The Jews build that up, buy out everything, build their own golf course, build their own hotel, because nobody wouldn't let them in the hotel back in the 50s. Okay. Right? So you understand, all I'm saying with my community, Lord God, let us not be like New York and Houston and those other places. Why can't we organize our community so we can have clout like the Spanish, for instance? I am going to be a little biased here. We have the best carnival in the entire universe in Trinidad. And we come down here fighting over foolishness and coyote show, which is nothing close to our potential, making millions of dollars, and our people fighting over $20,000. We can't get anywhere. That's a prime example of where I think our community, Americans, respect people who organize the community, who get representation, who have clout, and we have not doing it. And that has burnt me, because I know we are a smart people. Absolutely. So the purpose of this, the main purpose of this, I am going to make some attempt to organize this community. Now, I tried before, but I tried overall. Now I'm trying first in what I know, health. I am going to organize my community about health, meaning how to get good health care, learn how the system works, right? And that's what I'm going to do in these weeks to come. So you'll hear all kind of little thing talking, plus some medicine, but it's not going to be medicine alone. I am going to teach you in my community how to navigate healthcare in America. And that's the important thing. You have to learn to navigate. I don't care who wins this election. You have to learn to navigate it.
No matter who is in power.
Exactly.
You'll always need to learn how to navigate.
I know how to navigate. How? 50-something years in America. This is how I eat and drink. Mm-hmm, mm-hmm. This is what my wife do every day in my office.
All right.
Going after my money. I know how the system works, yeah.
So, ladies and gentlemen, there you have it. So, Medically Speaking with Dr. Winston Alexis is a podcast that is geared towards informing and educating the Caribbean community here in the United States and teaching us ways and means of navigating the medical or healthcare systems. Now, a parent company is called Caribbean American Connection, and that's connection with an X. And you'll see more and more features and functionality coming again as the weeks go by. We'll be launching our new website. We will have other features that we can, again, share this type of information with you.
And America is about, if you do not learn the system, and I'm doing this in medicine. I hope some of my compadres are thinking about what to do in education.
Correct.
Right? That it's my effort, is my know-how is medicine. Right? And I'm not talking as a gynecologist, because rumor has it that I'm extremely good. Rumor. Not sure.
Well, so I've heard from the ladies.
Right, so yeah, but I'm talking about more than my expertise in OBGYN. It's my knowledge of how the healthcare system works in America. And by the way, I learned it, and you know why I learned it? The way you should learn it. If I'm that's how I make my money. I better learn.
That's correct.
And I lost literally more than $100,000 or $200,000 because of ignorance in the early years. I didn't understand how it worked. But lo and behold, I found out. And since then, I've been sailing smooth. And that's what I want to do for the public.
All right. So, Doc, on the heels of our last episode, which was about sexual dysfunction, so I've gotten some feedback, I've seen some comments, I've heard some comments, and it has led to another topic that I think we should discuss on this episode.
Yeah.
Infertility.
Right. By the way, you're a genius at this sort of thing. I didn't know. Because I know you're trying a thing like me, but you're good. Because how do I know that? There's another host who used to with me for years, and he learned how to turn me off. What you're saying, Doc, already, now enough about that. Let me talk some damn medicine now. Is that the other guy with me was a genius, he turned me off. So you're learning.
I'm learning.
Because my wife was very worried about, I tend to talk. So I need somebody to guide me.
Well, I'm learning, and I hope I'm guiding you well.
Oh, you are? You make me laugh. So I realized that little move. All right, back to medicine is what Mr. Robertson is saying. Back to medicine. Infertility is an extremely important topic to everybody now, but especially our culture. You know why? Our culture.
Okay.
The Caribbean part of the Caribbean American, we bring thoughts with us into this country are what we think fertility is. We talk about some of it in sexual dysfunction. I have not met a man who come from Jamaica who is not a bull.
Yes.
I haven't met one. Maybe you have met some.
No, I don't.
All are we on top of the food chain. Yes. Oh, I am the... So one of the things is the porous of the man. That's one. Mm-hmm. The second thing is that we have been very, very critical and harsh about women who are unable to bear children.
Yes.
You don't... I have some names... Folks, I hate to say it, but I have to bring the point. In Trinidad, they used to call you a mule. Mm-hmm. Because, mule can't have children. Mm-hmm, mm-hmm. I mean, up to now, in my office, patients will come in and tell me, look, Doc, I said, what happened? My mother wants to know when I'm going to give her a grandchild. So it's not only the father and mother. The grandmother and the cousin, wait. I'm not saying whether that's right or wrong. That's our culture.
That's correct.
And
that's
now
right.
I would throw in my little part. I would say, hey, by the way, grandma, you know how much it costs to take care of a child in America, Grandma still think it's like in Jamaica or Trinidad, where you could have 10,000 child like my father. Right? We have about 13 people in the family, only God know what. No, America, you cannot do that. So I brought in a little thing again, part of the education. No, it's a way to have a child or two, but before you have them, you better know how you're going to take care of them, where they're going. And you are a man who are parents, so you understand what I'm talking about. The road gets tough as your children get bigger.
Absolutely.
So the first thing we need to do is put pregnancy in its perspective. It has a place, right? In every culture, to bear children is a right that women, I'm telling you now, women don't feel they're women unless they could, without you making them feel bad. Right? That's number one. Women, they don't talk about it, but it's something that all of them worry about. Especially in America, where because of a change in culture, childbearing has been put off.
Yes.
So you could finish your education.
Work on your career and things of that nature.
My daughter, who is a doctor, a gynecologist, did not have her children until she was, I think, 39 and 42 or something like that. Right? While most children back in the 50s, mothers in the 50s and 40s, by the time they're 19, they're one.
That's right.
Right? So because of this putting off childbearing to a later age in America, infertility has become a problem. Why? Fertility drops with age. Okay. Unfortunately, women, I'm always on your side. Men fertility lasts much longer than women. Men continue to make sperms all the way up to the 60s. Remember Karl Marx? Not Karl Marx, the Groucho Marx, the comedian, had a child at 70. Even though the boys down the road say, what child? He sure is his child. West Indian. Or he think it's his child. No. But no, they have evidence. Men can have. Women, when they go through menopause, cannot have natural birth. Let me tell you how I've changed that. If I was given this lecture 10 years ago, I would have said, women in menopause cannot have children. That is not true anymore. I see you shaking your head. You know why?
Yeah.
They can't use their eggs because they are no good. But we have the technology to use an egg from another person and a sperm from either the husband or a man, make the baby in some, and then do this thing called IVF and put it back. And if you prime the mother with the hormones that she is not making, her uterus will begin responding and carry the child. I think they had one in Italy, 70 years old or 60 something. What the heck?
Wow.
So where years ago I would have say, after you go through menopause, no more. Can't say, no more with your egg. You could get pregnant, but not with your egg.
So the mystery of modern medicine.
It's called IVF, in vitro fertilization. And I'll explain that a little bit before we get into the main stay of the topic.
All right. So, Doc, this episode's topic is infertility. This is Medically Speaking with Dr. Winston Alexis. New episodes available every Thursday at 11:30 a.m. Eastern Standard Time on your favorite podcast platforms. Google Podcast, Apple Podcast, Spotify. We're going to take a break and we'll be right back.
We'll be right back to Medically Speaking with Dr. Winston Alexis.
For excellent surgical care, call Dr. Ralph Guarneri's office at 954-462-8714. Dr. G is a general surgery specialist, experienced in surgery of the stomach, liver, spleen, pancreas, and gallbladder, to name a few. Dr. Guarneri also specializes in trauma and transplant surgery. Schedule your appointment with Dr. Ralph Guarneri today by calling 954-462-8714. That's 954-462-8714.
And we're back to Medically Speaking with Dr. Winston Alexis.
Please send your requests for topics or questions by email to questions@cacpros.com. That's questions@cacpros.com.
And we're back to Medically Speaking with Dr. Winston Alexis. So, Doc, you had started talking about IVF.
Right, because that's the modern thing. First of all, our people are deathly afraid of this. Because, with religious and thing, they believe it is not natural. All right? But I'm telling you, it is the wave of the future. And all we are doing is replicating what the end of a sexual act was designed to do.
Okay.
Which is bear a child. Believe me, the sexual act wasn't the important thing in sexual acting. Well, you could say you will. Because I know some of the guys said, Doc, you entitled to your opinion. I know better.
That's right.
But it was done for you to release sperms in the vagina. That's the only purpose for sexual activity, biologically.
Okay.
Let me
I just wanted to be clear on that.
Culture is different, biologically.
Okay. Some of us do it for fun.
Some? You know some who don't? I wish I knew. Anyway. So the important thing is put the sperms in the vagina. It makes its way all the way through the upper lining of the womb. They swim. These are some tremendous guys.
The strong swimmers.
Oh God. And the strongest one probably won. And they go all the way up in the tube of the woman. Fertilize the egg. And the male is done. We ain't need you no more. The woman does everything after that.
Okay.
Once that is formed, the baby make its way back into the lining, attach itself, and pregnancy up. What IVF does, it gets the sperms to meet the egg. Without fighting the journey the sperm have to do naturally. Listen now, this microscopic thing have to swim all the way up in the vagina, in the mouth of the womb, swim up the womb, swim down the tube. That is not easy. That's like me running from here to New York.
So does that function have anything to do with the man's, health?
No, not. Well, yeah, because if you have weak sperms, if they can't swim, they have a word for that, poor motility. They can't make it. If they have the right shape and form, when they reach the egg, they know what to do with it. They turn fool. You understand? So yes, the man has to do with good sperms that look good, can swim like hell. So there is some selection
No, for you gentlemen listening to the program, I want you to notice that I am trying to get some insight for us.
Right. Because frankly, I don't care.
Yes, because
I'm a gynecologist.
Exactly. So,
I'm on the woman's side.
And guys, I'm your friend.
Right. Well, you're trying your best, but I don't know if you're going to win this battle. But anyway, so once the man do that, he's done,
Right.
The woman has to carry the baby for 9 months. You see where I'm going with. So what IVF does, it takes away the peril with these sperm swimming. Some of them dead in the vagina. That's why you ejaculate so much, 400 million of them for one little egg. Woman put out one. And they're fighting to get up there. By the time they reach in the outer womb, another set dead. Mm-hmm. By the time they reach up, more dead. You understand? So by the time they reach there, half or 3/4 of them gone. Right? Understood. The woman put out one little lowly egg that sit there and wait for these idiots to reach. So you see, our job, the woman carries the biggest importance in procreation. That's what Adam and Eve thing was trying to tell you.
Right.
But this is in real life. So what we do, we put the egg with the sperm. We get the egg from the mother, modern invention. Mm-hmm. We get the sperm from the man. We wash up the sperm. And they had to swim no more. We put them in a dish. They still have to fertilize, but they're right there. So you see how easy it is. And when we form that baby, we put it back. So all the peril that the sperms have to go through, they don't have to go through with IVF.
Okay.
You understand? All this hard work they have to do. And many times, because of disease, they can't reach the egg. So in case, even if you have disease in either the woman or the man that prevent the sperm from reaching the egg, we can do it outside. Example, if a woman have tubal ligation, that means we tie off the tube. Mm-hmm. And what are we doing tying off the tube? The egg can't reach the sperm. We block the pathway. Long ago, we used to call these people sterile. And believe me, learn these words, people. Sterile is different from infertile. Sterile means you'll never get pregnant in your life again. Infertile means temporarily something is wrong that we can fix and you may get pregnant again. So we used to call them sterile. We have to stop that because the IVF, they're sterile no more. We could take the egg from the mother, the sperm from the husband, and put the thing inside the womb to grow.
Bypassing the tubes.
Yeah, you don't need it. IVF don't need the tube. IVF don't need the vagina much.
All right.
IVF don't need your sperm to swim. We have the little guys there. So I think people need to understand because people never understand they think it's something so unnatural. It isn't. Mm-hmm. We just taking away something that the body does. It is simple when you're having a heart transplant. You take the blood and you get the artificial heart to pump it until you could put the new one in and then you hook it up in. So we do it in medicine all the time. What's so magical about, doc, I don't know, that is natural. I say, listen, you understand what I'm saying? So I wanted to clear that up before we move on.
All right. So we have a question here, Doc. Mm. The question is, how does my age affect my fertility and chances for a healthy pregnancy?
All right. I said, I answered part of that question earlier. Mm-hmm. That the quality of a woman egg decreases with age. Every woman, everyone. Why is the DNA program that way? I do not know. Why men can continue making sperms. Actually, in one of my jokey moments, maybe I had too much to drink one night, I make a joke with Mrs. Alexis. I say, maybe God trying to tell us something in this. When you get pregnant, you are 9 months with a baby. I have whole heap of sperm still here. Maybe when you look at my job is to replenish it. I can't tell you the words she say. She cussed me.
I can imagine.
Oh, yeah, but coming back to the point. Woman eggs are finite. They have a lot of them, but after they are born, they're born with all. They don't make one more. All they do is release them every month, but they're there to start with. They are born with millions of eggs, and they only ovulate about 300 in their lifetime. Why? That's another thing we have to answer. Why so much? I really think it's natural selection. The best ones get chosen to be released.
Makes sense.
Right. So anything that interferes with one, the release of these eggs, two, the tube through which they travel to meet the sperms can interfere with fertility.
You're saying it can?
Yeah.
Okay.
Usually that's the most cause of, number one, they're not putting out the eggs. They may have them, but they're not releasing them. Number two, the tube's blocked because of disease.
That's just okay.
Yeah. Number three, the lining of the womb is not in the right phase it's supposed to be.
Mm-hmm.
Right? Those are the reasons I've just given you in the female for failed fertility. And my job as a gynecologist is when you come into these complaints, explain somewhat I'm explaining now and tell them how we're going to get by it. For instance, I can give women drugs to make them ovulate. Regardless of what disease they have, there are things I can do. There are things I can do to fix the tubes, or IVF, get by the tubes. You see where I'm going with this?
I see.
Right? So infertility, remember, is not sterility. It means you have a condition that can be corrected with therapy and diagnosis.
All right. So that's a perfect segue, Doc, into the next question.
Could I just finish up a little bit?
Absolutely.
I didn't quite answer the question. You're born with them, but they age.
Mm-hmm.
If you're born with them when you're 40, how old is your egg? 40 years old.
Right.
And a 40-year-old don't act as good as a 10-year-old egg. So yes, as you approach menopause, the older you are, the less viable are your eggs. And it starts somewhere around late 40s, and usually, they like to say 35 in your books. I don't, yeah, your women say, oh, I'm passing my age. 35 is 40, foolish, but certainly by 40. What I'm saying, most 35-year-old women will get pregnant.
Mm-hmm.
A lot of 40-year-old don't get pregnant because the eggs are of not good quality. They're old. And after 45, almost impossible.
Okay.
You could still get pregnant, but not with your eggs. And you could buy eggs on the market, by the way. It's a big business in America. They get the eggs from college kids and sell them to older women.
Okay.
One went for as high as $60,000 in California.
Oh, man.
Or somewhere. You know what? Why? By the way, to match up your DNA and thing, and your education level. It's not that thing where you just go pull out an egg. But if I black, they're going to find a black egg. If I was well educated, to make sure the father of those sperms were well educated. They match you to color, eye. It's a big... But you know why? When they do the genealogy of this woman, her father was a professor emeritus at Harvard. Wait. Her mother was a professor at Harvard. And she was a junior professor at Harvard. $60,000 somebody offer for the eggs.
Okay.
Because they're looking at the DNA and say, okay, I'm bringing this DNA. This is superior DNA. It don't always work out that way.
Well, I'm going to have to.
Yeah.
I'm going to have my sperm assessed.
I did not say anything about your sperm. I think I might be opening up a bag of them. Them guys saying, well, my sperm, I have serious sperm.
Back to the question. The second question that we have is, are there any lifestyle or medical issues that can affect my fertility?
All right, we mentioned one.
Yes.
Disease.
Yes.
If depending on how you are, if you get sexually transmitted infections like chlamydia, they can damage the tubes. Gonorrhea can damage the tubes. There are some genetic disorders like polycystic ovaries where the woman do not ovulate well. All of these are treatable infertility problems. Now, if you're born with an ovary, you're sterile. I mean, if you don't have ovaries. Mm-hmm. Or if I do a hysterectomy and remove your ovaries, you can't get pregnant because you're missing a important ingredient in the pregnancy process, which is a uterus to nurture the baby until it reaches a proper age to live in this society. Right? So disease can. But I suspect she's asking about other things. Like, for instance, sensimilia. In other words, can ganja or marijuana affect your ability? Questions. I know it doesn't.
Okay.
How do I know that, Turun?
You tell me.
We wouldn't have nobody born in Jamaica.
Well, this is true.
Because everybody spoke up sensibly. That's my study. But as far as studies are concerned, they say marijuana chronic use could probably alter sperm production. Right? And could, I have never seen it, but the book says so.
Okay.
Because I practice in Jamaica. I mean, believe me, everybody smoke ganja, but they're fertile like hell. But you have to go by the studies. And they say cigarette smoking may have some, have much, your lifestyle books tell you, right? Your ginseng and how all of these things could either boost it, or if your immune system is poor, yes, there's some things that say there are some environmental factors that can interfere in the quality of the sperm.
Okay.
Or the quality of the egg. Now, do I believe that? I don't know.
All right.
Okay.
What about things like alcohol and the foods that you eat and that type of thing?
Alcohol is specific. In the man, nothing. Alcohol in the woman during the pregnancy can cause serious congenital effects in the baby. And we're talking, well, let's get this straight. We're talking about drinking at least a QQ every day.
Right.
We're not talking about one who have 2 glasses of wine when they go out. Even though in America they cut all alcohol. But in reality, a couple of glasses of wine here and there during a pregnancy never cause anybody any harm. But of course, an alcoholic who is pregnant can get alcohol, can be serious affected. All right. I don't know if people know this little thing. You know how we used to stop premature labor? You know that women going into labor before time?
Yes.
Now we give them fancy medicine. You know what we used to treat them back in the 60s?
Tell me.
IV alcohol. We used to put a drip. They used to get drunk. Because alcohol decreases contractions in the uterus. Lo and behold. I tell you, human beings are very hard to kill and very hard to mess up. Because the medicine have gone through some shaky times. When we were doing things we had to show off. Now we have studies. Back in the 50s, out there those studies, they give it to you, and if you're dead, they say, oh, I guess we better watch how we give this thing.
Well, things and times
what I'm telling you is not a joke. I trained giving IV alcohol to women to stop labor. And by the way, all of the babies did well to me.
All right.
So it's not acute alcohol. You drink a petty quart for one day. I ain't gonna do you. They're talking about the chronic use of alcohol during. Cigarette smoke, same thing. They can cause serious problems in the development of the child. And, you know, the question is still up in the air about sensimilia.
Well, we'll leave that one alone for now.
You think I better leave
Leave that one for now.
before they read the show?
Well, ladies and gentlemen, that's Medically Speaking with Dr. Winston Alexis. We're going to take a short break and we'll be right back.
We'll be right back to Medically Speaking with Dr. Winston Alexis.
For the absolute best obstetrics and gynecology care, call South Florida OBGYN at 954-452-4377. Schedule your appointment today with Dr. Winston Alexis, who has been serving the women of South Florida for over 25 years. Conveniently located in Plantation, Florida, the courteous and professional team at South Florida OBGYN are standing by to assist you. Schedule your appointment today by calling 954-452-4377.
And we're back to Medically Speaking with Dr. Winston Alexis.
Please send your requests for topics or questions by email to questions@cacpros.com. That's questions@cacpros.com.
And we're back to Medically Speaking with Dr. Winston Alexis. Doc.
Yeah. Listen, man, I always bring up Jamaica because I believe in anecdotes, you know. I think anecdotes tell a story more than anything else about how men feel about sexuality and getting a woman pregnant and how important it is to our culture, right? I'm at Moby one day. I come in about 11 o'clock. I come to Cornwall region. And by the way, they know some of them wicked in Jamaica, you know, all of them laughing. So I said, what going on here? They said, Doc, there's a patient husband want to talk to you inside. So I started to say already, oh my God, wonder what happened. What? So I go in there. So they say, I said, sir, I heard you want to. He said, listen, man. I hear something about my wife want tubal ligation. So I feel already, I know how man feels. So I thought I know the story. I said, no. If all you don't want it. He said, no, I ain't telling you that. Yeah, the woman has 6 child already, me I want no more. But they tell me, you're going to tie a tube. I say, yeah, what do you mean? We're going to tie the tube. So the sperm, I'm explaining to him, you know me already. The egg can be this sperm. He said, Doc, you know my sperm? No thread. No thread could keep back my sperm. I want you to cut it out. Tie? Listen, the nurses and them start laughing and roll on the ground. So I say, okay, so no man. I say I cut it, but I tie. But you also cut out a good piece. He say, oh God, thank you, God. Because I thought you tied this tube. You don't understand my sperms.
Well, it's a Jamaican
no
man.
Piece of thread could hold back.
He's a bull that he has
yes.
strong swimmers.
He said, thread? What thread?
Well, Doc, I have another question
Yeah.
from a lady. And the question is, can my menstrual cycle be an indication of my infertility?
All right. 85% of all right, 40% of infertility is due to the woman not putting her eggs out. And 80% of that 40% is a condition called polycystic ovaries. Okay. And the main symptom of polycystic ovaries is irregular menses in a young girl.
Okay.
Not just a young girl, a menstruating female during the childbearing years. That means somewhere between 17, 18 and say 40. Leading cause. So yes, it is one of the leading causes of infertility in females. Abnormal periods, which is an indication that they're not releasing the eggs.
Interesting.
That's what the irregular periods is a signal of. That's why, remember, in one of our programs, we were talking about how important it is to chronicle your periods.
Yes.
Because it's a very important sign. When you start skipping regularly, I, as a gynecologist, if you come to me with infertility, I think I know the answer before I even touch you. That you are probably not putting your eggs out. Now, my job is to find out why. There isn't only one thing that makes you not put out your eggs. A lot of things. For instance, thyroid disease. They have nothing to do with, but it can cause your eggs not to be released. Diabetes. They have nothing to do with the womb. It's your liver and your sugar. But that disease side effect is you can have infertility.
So that should be an important, I guess, part of the message that we pass on.
Yeah.
In that diabetes, for example, is a popular disease in our community.
And can lead to anovulation, which is a definition for not releasing your eggs.
Interesting.
Thyroid disease can do it. Many other diseases. Mm-hmm. Things like lupus can do it. I mean, they have a lot. Stress can be cause of irregular periods, physical and mental. In other words, marathon runners get anovulation because the stress of the running interfere with the cycle that make the woman put out the egg each month.
So that's an interesting, I guess, topic. So you mentioned marathon runners. What about a woman who works out?
Yeah, same. Yeah. A woman who don't work out and stressed out, same. I thought you were going to ask me what all of them have in common. They are all processed in an area of the brain called the hypothalamus. In other words, the woman ovulates because of something that starts in the hypothalamus. When you overexert yourself, it causes dysfunction in the hypothalamus. When you are stressed out, it causes this. So what you have, when one is doing it, it short circuits the other. So even though running have a damn thing to do with ovulation, but running screws up the area that determines when the woman ovulate. So they all process stress, physical and mental. So that's why I'll take physical exertion as the runner. Mental stress can do it, right? And irregular hormones from the pituitary gland, which also is controlled by that area in the hypothalamus. That's the connection between the 2 and 3 of them.
Okay.
Making sense? Well, again, I'm getting into some deep stuff,
Making perfect sense.
But women, I just want to give you the overall picture of how things go.
Right.
And by the way, when we go to the community too, and we start to talk, when I start to tell you healthcare and how you can learn about it, not about this disease, you say, come to me, you ain't need to know. You just need to know the symptoms.
Right.
But how to navigate the healthcare system. Just for a short, I'll give you a minute. You know me? I have Medicare. I don't have no medical plan. I mean, what they call prescription. You know why? I found out somebody come into my office and said, Doc, I want to give you something for your patients. What's the name of it? Good RX.
Yes.
So I said, where's that stupidness? One day, I went down to the pharmacy and carried it. I just say, I see it in my wallet. Let me ask the guy. My prescription for my eye drops was $246. I pay $63. So one of the things my public, there are a lot of free stuff on the market. You better learn where they are. I'll give you one other example. Nobody has to pay for a mammogram. Once a year, during breast cancer month, anybody can get a free mammogram. Anybody. So that's part of how you navigate the system. You look for everything that's free.
No.
Yeah, back
again
on the subject. So
yes.
Oh, you're bringing me back. Okay, all right.
Back to the subject. Because again, ladies and gentlemen, there will be a program or programs where we will specifically speak about things like insurance, things like Medicare and Medicaid,
right?
And where to find these again free programs and
since the time to change your I was going to do it tonight, but my goodly wife reminded me. Open season, the time when you can change it, is all the way in November. So we don't want to do it too early.
Okay.
I want to do it just at the time people will be changing their insurances.
Leading into open season.
So that's why we replaced it with this. That's why I'm talking a little bit about it still, because I had prepared for that. But I guess I know medicine. You could tell me in a short moment what you want.
Absolutely.
Am I ringing my own?
Well, just a little bit.
But the truth is the truth. What can we
bit.
do?
Just a little bit.
A little Muhammad Ali complex, right? If you're good, say you're good.
All right. I have another question from a lady here. And the question is, I woke up every morning for a year and took my temperature and used a fertility kit. Should we as women rely on those kits?
You want my answer? No. I'll tell you why. What do the kits do? All right. There is only 48 hours in any cycle, a whole month, that a woman can get pregnant. You know why pregnancy is so hard to achieve even in normal people? If you don't hit that 48 hours. Remember the month is 31, and you have 48 hours to find. Now when you're young, you could see where that is not a problem. Because sexual intercourse is like having breakfast. You do it every day, all day. That's why younger people get pregnant more often. It's not that the man more powerful. As you get older and your life gets to be more complicated, right? I'm talking about now in the absence of disease.
Yes.
You still have cut down on your, even though don't tell that to West Indian man. As a matter of fact, we lie for years saying we still are here doing nothing. Really? But anyway, so the problem is they have come up with kits in the pharmacy to see if they could pinpoint that 48 hours. By one of them, you pee in a cup, and the woman dip. And when they think she put the egg out, it start to change color. And the time they make sure, I ain't care what you do for the rest of the month, boy, but you better be here when this thing turn blue. Right? They're trying to get ovulation. The problem is this. By the time that turn blue, the woman already ovulate.
Okay.
Let me tell you how it works. When you ovulate, you make a substance called progesterone, but it takes a day or two. And that is what make the temperature chart go up. That's what make the dipstick change color. But the horse out the gate already.
Yes.
You might still catch it, but you're in the fringes. You ain't catching. There's nothing on the market that can tell you exactly when ovulation occurs.
All right. So just have regular sex.
Right. Well, what you have to do, yes. Right. And you want to be, let's suppose a woman is infertile and we can't find nothing wrong with them, which is about 15% of the normal people. So we try to time it. And you know what we tell them? Listen, have sex every other day. Guess why we get every day? It's going to live 48 hours. So if you have sex today, you don't have sex tomorrow. That's only 24 hours. It could wait another 24. So you know, every other day. But don't get me wrong, there's nothing wrong with trying it.
Okay.
Right? But make sure you maximize your sexual activity when the color change occurs or the temperature chart changes. Because that's your fertile period. The Catholic Church, and I'm a Catholic, they don't believe in contraception. That's why I'm excommunicated. The amount of women I give pill and tie the tube. But Catholics believe in this. It's called the rhythm method. You have a natural method, rhythm. In other words, you're taking the rhythm when the egg come out. It doesn't work most of the time. But there's nothing wrong. It's not going to hurt you.
So
and maybe you might catch it. So my point is, I tell my patient, you want to try it for 2 or 3 months, but I don't really think it's going to work. So when you try out your thing and it don't work, come see me.
all right.
You understand what I'm saying? I don't tell, that's stupidness. A lot of doctors do that. I don't think that's right because some people may get pregnant on it, but the vast majority would not.
Okay. So, Doc, let's talk about our community and these things now.
But again, it's the same drum, people. I heard you telling them, we're going to beat in this drum for years. So you better get accustomed to we on this platform. Yes, it's health, but it's beyond health.
Yes.
Our goal is to make sure the people in our community understand how the healthcare system works. And I'm hoping down the road somebody will teach them some of the other system, how to buy a house.
Right.
So we could organize our community. And most important, and I need to keep saying this, I learned a few things from my Jewish friends. And I have a bunch of them, my whole golfing community, mostly Jewish guys. Because I tease them, I say I live in Jerusalem. When you live in Plantation, Jacaranda, you're in the middle of Jerusalem. You understand? And these fellas teach me something. They will walk an extra mile to give a Jew a job.
Yes.
An extra mile.
Mm-hmm.
Right? And good friends of mine in that community have been asking me this. Winston, you know how they found out about me, all these guys? Because a lot of our people do home health for the elderly parents,
Correct.
the Jewish community. And every one of the workers who go, Alexis, the answer is yes. So they come to me and say, Winston, how come everybody know you? And they were telling me, you have such an influence in our community. Why aren't you using it? And they were right. I just didn't figure out I had time before.
Well, you're using it now.
And nothing happens before it's time.
That's right.
What I want to do, I want to educate my community on healthcare.
Yes.
And other things.
Yes.
I'm going to take care of the healthcare,
Mm-hmm.
and the other things will come after.
Indeed.
And it's how to navigate. That's the problem in America, It's not that we don't have a good system. They make it so complicated you can't navigate it.
Yes. Yes.
Anyway, the point here is I try to get advice in every aspect of my life that does not involve healthcare. I don't need no help with healthcare.
Speak to the experts.
Yes,
ladies and
like
gentlemen.
you.
Speak to the experts.
You already tell me you are an expert in infertility. Is that the male You will carry the case of the man.
All right, that sounds better.
That sounds better now.
That sounds better.
Okay, yeah, man.
Ladies and gentlemen, that's a wrap for this episode of Medically Speaking with Dr. Winston Alexis. New episodes available every Thursday at 11:30 a.m. Eastern Standard Time on your favorite podcast platforms. Google Podcasts, Apple Podcasts, Spotify. Doc, you had something you wanted to say?
No, I just wanted to say I hope the people understand how much I'm enjoying this too. This doesn't feel like work to me.
It's not.
No, I'm enjoying every minute of it. And not only that, I'm beginning to feel better about myself. Because medicine don't mean the same thing to me. And I practice it for 50-something years. Yeah, I'm good at it. I think I'm worth a little more than this. My father told me that. Contribute to the society in which you live, and then you would not have lived in vain.
Indeed.
Never forget that. Okay.
Thank you very much, Doc. Ladies and gentlemen, take care. Talk to you soon.
At Goals and Spine, we provide a family environment where we instruct patients on proper exercises and techniques while offering chiropractic adjustments. Give our team a call at Goals and Spine Rehab Center. We're here to help you turn up the light.
We appreciate your time with us on Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join us next Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms. Doc is back. Although the host and guests are qualified professionals, they assume no responsibility for inaccuracies, omissions, inconsistencies, and any slight of people or organizations. Listeners should use their own judgment or consult an expert or their personal physician for specific applications to their individual medical problems.